Can I start? Okay, let's try again. So I'm going to begin with some basics. These are important, even self-evident, but are often forgotten. Every government action needs to be backed by a law. Without legal backing, government cannot act. So when you hear someone say, why can't government do this? Why can't government do that? Whether there is a pre-existing enabling law. Second, the purpose of all law, or its more familiar cousins, acts and rules, is not to be legally elegant, but to facilitate practice. We assess the performance of the Disaster Management Act. The touchstone is not ideology, but relevance, utility, and convenience. In short, the proof of the Disaster Management Act pudding. Third, referencing the disaster management alone would be an incomplete exercise because the Disaster Management Act, the Epidemic Diseases Act, and the IPC 1860 in tandem have been the principles have leveraged in fighting the COVID-19 pandemic. I just wanted to articulate these three premises up front so that we stay on course. It is strange and surprising that the act is so young, as 2005. It is just 15 years old. To jog your memory, India faced catastrophic natural disasters such as the Gujarat earthquake of 2001 and the Indian Ocean tsunami of 2004 framework in place other than the archaic colonial relic of the Famine Code. The enactment of the Disaster Management Act in 2005 did several important things. It created an overarching legal framework. It was uniformity and standardization of response. It replaced the relief-centric approach to the Famine Code with one that emphasized proactive prevention, mitigation, and preparedness, and it created a multi-level institutional system. The states and the districts are all covered. Before we move, let us understand that it has enabled not just the 4,000 plus orders and circulars reportedly issued by the union and state, a mechanism for their implementation all the way down to the district collector. It has also enabled us to rapidly put together a vast battalion of field level workers, doctors, ASHA workers, NSS, medical and computer technicians working together, sharing information, pooling resources towards a common cause. Does the Act have shortcomings? If so, therein lies a response, knowledge, and correct. Going back to my initial remarks, the touchstone of the efficacy of a law is whether it facilitates practice. Therefore, we need to focus a critical lens on the deficiencies that come to the fore while we form a response to COVID-19. So let us do a reality check. The first question is the Act adequacy. Though the NDMA has formulated guidelines on the management of biological disasters in 2008, management plan in 2019, which deal extensively with biological disaster and health emergency, states still found it necessary to invoke the Epidemic Diseases Act, which is a pre-independence legislation, and also various state-specific acts. Also, the implementation of the lockdown saw the invoking of Section 144 of the IPC. Is this because, despite being an umbrella framework of dealing with all disasters, the Act has been mostly envisaged to respond to calamities such as floods and droughts, more familiar in our subcontinent than an unprecedented pandemic such as the Covid-19. In fact, Covid-19 is the first pan-Indian biological disaster of this scale in institutions of the country. This is also the reason why some have argued that India needs a separate legal architecture to deal with public health calamities. Whether we need a separate public health act or whether we need to is something which I would expect today's session to deliberate upon. The second touchstone is ground level implementation. The effective implementation of the national and state government decisions under the Disaster Management Act at the grassroots level. Here, the district administrations and local self-government institutions remain its best bet. Much before Covid-19, the Act has been criticized for not providing enough scope for NGOs and non-profits. The migrant workers shook our collective conscience, this apparent exclusion took on greater emphasis in public discourse. At the same time, I know from personal experience that my NSS volunteers, for instance, were able to work effectively in the field. Could they do so? At the very outset, even before lockdown 1.0, we instructed the NSS that they would be on standby mode and available to district administrations for any services called for. Next, we called coordinators who are all university faculty with a training session in coordination with the National Health Mission, again as early as 23rd March 2020. Then, throughout the lockdown period, we educated through a series of informative, educative video sessions and webinars in coordination with LIMANS and the Rajiv Gandhi University of Health Sciences. These sessions became hugely popular with medical professionals, non-medical professionals, and even NSS members outside the anecdotal evidence in the media that some individuals rose to the occasion and provided migrant workers with food, water, transport, and the like. The point I'm making is that the Act is not exclusionary in intent or purpose, but it does demand that for effective functioning, the voluntary mechanism works in sync with and perhaps the directions of the district administration and requires close coordination with the governmental and where this coordination could not take place, ground level synchronization did not take place. So the question for your deliberation, should the Act be so inclusive as to allow for independent functioning of non-governmental organizations or this is a question that the forum may find interesting. The third touchstone is again related to the question of coordination. The Act is hierarchical in design. Its unstated premise will carry out instructions of the superior agencies and information flow from both below to above and above to below is optimal. In a federal structure like India, complicated by contextual dissimilarities of geography, leadership, and the curve of the disease, such assumptions are dicey. Biological disasters of a national magnitude necessitate close administrative and political coordination of the union and state governments, disaster management authorities, and all other stakeholders, including the people. As per the mandate of the Disaster Management Act, a concerted effort is required to ensure that these bodies are administratively, politically, and financially empowered. In the true spirit of the Disaster Management Act and the federal structure, political and administrative agencies have necessarily to be more collaborative and consultative. But the report of the task force to review the Disaster Management Act in 2013 suggested that the present structure of the various authorities is not conducive for carrying out the tasks it has been mandated to perform. For instance, in one state at least, we found that the panchayats had to be empowered to purchase masks, sanitizers, and so on. Why was this even the movement of migrant laborers, availability of food, arranging livelihoods to daily wages, relief camps, entitlement of statutory minimum relief? All these directly affect millions in the country and need special flexibility, iteration, and ready action. They require pre-existing robust mechanisms. Does the Disaster Management Act require a tinkering for a more democratic and empowered functioning at all levels at the implementation stage? In other words, does this imperative require structural, institutional, or practical address? This is something we can discuss about. The Disaster Management Act is far-sighted, robust, and comprehensive piece of legislation, but it is certainly correctable. I have pointed out some areas of potential interest, and I am sure you will find others. With these words, I wish the deliberations of this forum all success. Thank you all. Thank you.
Thank you so much, Kalpana ma'am.
Thank you.
It is my pleasure now to invite Dr. Rajesh, IFS, Director Niti Aayog COVID-19 Core Team, Department of Health Research, Government of India, to share his views on the topic.
And Madam outlined the important aspects and contours of the Act, which is the one which we are currently using along with the other couple of legislations to deal in the current scenario. As you know, COVID-19 is a pandemic of unprecedented nature, and we have been fighting very hard across the country, across the districts, to deal with this pandemic. And as of today, with our efforts, we have done more than like 2,20,000 tests per day. That shows the scale of involvement currently going on in fighting this disease. So it is very clear that it cannot be simply dealt with one single approach. So we needed a multi-stakeholder approach to deal with it. So in this background, let us analyze how Disaster Management Act is helpful to us in dealing with this pandemic. Prior to Disaster Management Act, we had a century-old Epidemics Act, which was enacted in 1893 by the British government to deal with the plague situation in the country. In fact, that was the first act which was invoked by the government authorities, even to deal with the current scenario, especially for regulating the arrivals and departures of international flights and all. The Act, particularly Section 2 of the Epidemic Diseases Act, 1897, was the first instrument that will be used in dealing with this pandemic. Thereafter, it was coupled with the provisions of the Indian Penal Code, particularly 144, to restrict the issue of social spread of the disease. Now at this moment, let us little go back to our statutory books, that is the Constitution. As per the Constitution, health is a state subject, and this issue of COVID-19 is a health issue. So if we use health as a terminology to deal with, then it is largely a matter of health, state government. But it is not ending there. It is such an epidemic, it is crossing the boundaries, it is crossing all profiles of the society. So we needed a larger response to this. So on March 14th, we notified this as a disaster under the Disaster Management Act. So what is the benefit which we can get from Disaster Management Act? Disaster management is put in the concurrent list of the Constitution. So being there in the concurrent list, both central government and state government can very well act on it. So where from this is drawing strength in concurrent list? In our Constitution, we don't have a disaster as very particularly defined. It is relatively silent. But we have entry number 23, which is about the social security and social insurance. That gives strength to this entry, this concurrent list entry of disaster. Secondly, we are deriving strength for Disaster Management Act from entry number 29, which is prevention of extension from one state to another of infections or contagious diseases, pests affecting man, animals, or plants. So the overall ecosystem is clear. We have now an additional level of empowerment, which is the concurrent list subject, which is the disaster management, which has linkages to the entries in the Constitution. So now we have two situations in front. First is health, which is the state subject, and second is the disaster management instrument, which is in the concurrent list. So we are ready now with a complete set of legal instruments for dealing with the situation. So if you just recollect the chronology of invoking of these events, we can understand that on March 11th, the government utilized Epidemic Diseases Act 1897. Then on March 24th, with the declaration of the locking down, we resorted to the Disaster Management Act. Now let's come very closely on Disaster Management Act. What is very important for us? Disaster Management Act, as Madam specified a little ago, it is a very comprehensive instrument which encompasses rather a complete profiling of institutions from center to district and sub-district. It is ensuring such a level of vertical integration across the country, irrespective of the states and districts, to have a uniform sort of action. At the same time, it doesn't end there. It ensures a horizontal integration also of different departments in the government of India with clear mandates. Rather, it says that every department should have a disaster management plan prepared and integrated with the national plan, or even got approved by the concerned state level or district level or even national level. So it is so comprehensive. Perhaps this is the greatest benefit we could derive after our experience with the tsunami in 2004. So in 2005, we got this act, and we have experienced this act over the last 15 years with the different instances of disasters happening in different parts of the country. So we are gained sufficient, and we are utilizing that experience in dealing with this current situation. And we are very much effective as well. That's why even our current test positivity ratio across the country is well within the WHO limits. So of course, challenge is not over. Still, we are fighting the pandemic. So we have to continue with this. And at this moment, what is more relevant is to give a wider understanding of the provisions of this act to the masses, because an effective disaster response is happening in three forms. First is prevention, second is mitigation, third is preparedness. So, from these perspectives, maximum emphasis is laid at the district level. If you look at the architecture of the Act, there is a national level disaster management authority, there is a state level disaster management authority, there is a district level disaster management authority also. And what is more beautiful about the Act is that Act itself is providing resources. It identifies resources for implementation of the provisions of the Act, which is not a regular phenomenon found in other acts. They prescribe the directions or policy outlines and leave to the government to identify resources to support. But here, it provides resources also identified through the same piece of legislation to implement the the actions identified under the action plans. And if you look at the core of the implementation area, which is happening in the district, it is so wonderful that a great deal of powers and functions are given to district authority. So, as a community, rather at this moment, we can engage with the district community, district authorities at the field to strengthen their efforts, maybe in terms of social distancing, maybe in terms of strict adherence of respiratory etiquettes like wearing masks, or even timely notification of the violators of quarantines. So all these things are small efforts, but it can do a great deal of support to the efforts at the field level to deal with this current challenge. And Madam also mentioned about the role of social engagement of volunteering forces, which is a very clear mandate under the tasks assigned to the district authority. It encourages involvement of NGOs and voluntary social welfare institutions at the grassroots level for disaster management. But then this has to be as per an approved disaster management plan. Otherwise, instead of organized response, there could be chaotic response as well. So, understanding the Act in detail and responding to the pandemic at field level with every sort of evidence-based approach is key now. That is the requirement at the moment in the field, because challenges are varying from uh, location to location. Even a particular location could be a sort of a normal area today. Tomorrow it could turn, or in a couple of days, it could turn into a high containment zone. So these are all like very dynamic. So to deal with dynamicity, it is always important that we keep people informed about the provisions and the ways in which they can engage with the Act and deliver a good governance of the provisions for service delivery in this field. That will make a significant impact on dealing with this pandemic with the help of all the stakeholders concerned. Now, if we come to the penalties, yes, it prescribes penalties because the Act is not only outlining the responsibilities for different authorities, it also outlines the ways to ensure compliance, even at different levels, right from nation to state. So, if according to the Act, if a person who is not supposed to act is also not acting, is also an offense. At the same time, a person who is directed to respond to a situation in the field under the Act, and if he fails, is also responsible. So that way, this Act is ensuring a great level of coordinated response to the field. But what we will perhaps miss is this coordination, which is happening between those forced to act and those who are ought to act. So that difference, that gap can be bridged by proper social education of the relevant provisions through volunteering, through coordinated, inclusive, local level disaster management plans. With these words, I would like to thank the organizers, IJASRH and the LEXPRISE for organizing this webinar, particularly on this theme, particularly when we are fighting this evolving pandemic, which is like challenging us in a great way with our resources, our daily lifestyle, even economy. So I wish that every participant here in this webinar will take some clues from this act and engage with whoever is possible to be engaged within the district or in the sub-district to deal with the pandemic and contribute to control this at the earliest. Thank you so much. Stay safe.
Thank you, sir, for your views on the topic. Now I request Sumitra Chowdhury, Advocate, Supreme Court of India, to please deliver her talk.
Hi, thank you, Soumya. Thank you to all the organizers for giving me this opportunity once again. I'm on the travel, so I'm sorry in case the disconnection. I didn't want to miss any opportunity to interact with you guys, and that's why I didn't cancel. Coming to COVID-19 and what this disaster, what this epidemic has actually put us, I would want to put forward my point saying that the lockdown was actually a massive logistical and implementation challenge for all of us. And looking at the geographical diversity that we have and the population, the income inequality, the population density. So this global pandemic has actually become a big challenge for law enforcement as such, for the society as a whole. So in a country as vast and diverse as India, emergency responses will have to be tailored. So it cannot be a one size fits all. So it has to be a tailored response. And that is what our state and national government, our central government tried to do it. And to do this, it becomes really necessary that the state and the central government work hand in hand, which they did very effectively. So the National Disaster Management Act 2005 is a very comprehensive act, and it has pretty much all the clauses, all the law that is required for the machinery to operate in situations like this. So this pandemic has been like a crime which knows no border. So it is not only that we fight this individually, but together. It has actually given us a lesson of how we stand together and fight a situation like this. Taking you to the act, in exercise of the power section 621 of the Disaster Management Act, there is a power to the central government to constitute a committee. Hello, can you hear me? Okay, good. So, in exercise of the powers under Section 621 of the DM Act, the central government had issued orders on 24th of March directing all the ministries and departments of Government of India to take specific measures according to the states and their requirements. So similarly, MHA, the state governments, everybody sprung in action and they had announced lockdown according to whatever the situation called for their particular state. So basically, when it comes to epidemics, there are three laws to be aware of, and that is the Epidemic Diseases Act, which is a very old act, 1997. Then there is the Disaster Management Act 2005, and then obviously there are provisions related to penal provisions related to our IPC 1860. So the Epidemic Diseases Act, it does special measures and for containing the outbreak. So you must have heard a lot about Section 188 IPC during this time. So there is a lot of action that the state implementing officers get under this act. So Disaster Management Act, the act gives a provision wherein there's a NDMA, National Disaster Management Committee, that is formed, and the president, the prime minister is the chairman of that committee. Under what is good for the country and how to implement those laws accordingly. So there are certain provisions in the Disaster Management Act which are of penal nature, and they extend from Section 51 to Section 60. which tells what all constitutes an offense when it comes to disaster management. So, Section 51 of the Disaster Management Act provides for punishment of two different kinds. During the disaster management, when a certain guideline has been passed and somebody who doesn't follow it, or who either obstructs the officer or refuses to comply with that act, becomes liable for action under Section 51. So Section 52 also is a penal provision again, wherein a sentence has been prescribed. Similarly, Section 54. So it is not only for the citizens, but also for the officers who are supposed to enforce the provisions of the Act and who are not able to dispose of their duties properly. See, COVID-19 has posed a lot of threats to us as common citizens. So, looking at the legal aspects, looking at the citizens' rights and duties, it is important that we all work hand in hand along with the enforcement agencies and let them do their work properly by cooperating with them. Because it is a national emergency, definitely it's a global pandemic. So it's an emergency for everybody around the world, and it is important that we do our duty properly to ensure that we fight with this and emerge as a winner. So a law can only prescribe what to do and what not to do, but it is basically the citizens and their duties and responsibilities which ensure that something has been done properly. So even after the 3 months lockdown, the country has gone through a lot of it has taken a lot of economic brunt. There are a lot of people who are unemployed. There are a lot of issues. People are not able to pay their school fees. There are huge EMIs that has been pending for so many months. There are no sources for earning. So it is really important that at this time, we all ensure at least the basic thing that we could do is follow the law. So I would just say that, just follow whatever the guidelines we have been getting. The state is trying its best to help its citizens, and so is the law trying to do. So there are a lot of PILs that are reaching the Supreme Court, that are reaching various high courts, where people have been trying to get the relief, and they have been quite sympathetic to issues that have been generated due to COVID-19. So I just want to end with this, saying that kindly remember your rights, but also remember your duties. Thank you.
Thank you, Sumitra ma'am. Now I request Dr. Jacinta D. Silva, Assistant Professor, Model University, Dubai, to please share her views.
Yeah, can you hear me?
Yes, ma'am, we can hear you. Please continue.
Okay, great. Okay. First of all, good morning to all those who are there listening to all of us. And I would definitely like to salute all the officers and all of them, all those frontline workers, especially who are working day in and day out in this specific moment to keep us all safe and sound. So it's a great honor to have wonderful officers working in for all our safety and requirements. With that, I would like to start my presentation on the ambit of disaster management. Well, till now, Dr. Kalpana, Dr. Rajesh, and Advocate Sumitra have done great job. So they have covered almost everything that I could talk about. But I'm going to take a different take on this discussion, a little bit from the student and the education point of view. If you look at the slide at this point of time, I've just created a little bit of a discussion here so that you understand, especially the students understand what we're talking about. We're talking about the Disaster Management Act, which was designed in 2005. Of course, a lot more has been done than what you can see up here. Just the basic definition that you can see on my screen is this is associated, or disaster management or disaster is associated with some kind of a natural calamity. However, what we are going through right now is a kind of an health hazard or a health issue, like Dr. Rajesh rightly pointed out. So therefore, WHO and definitely the government of India has decided to call it as a notified disaster, which means it's a critical medical condition, and we all are responsible to take care of ourselves in order to reduce down, or probably to flatten the curve, as we always talk about, or whoever comes to talk to you. It's basically that's take care of yourself so that we can try to flatten our curve, so that we can use our resources in the best possible manner. Yeah, of course, we could not solve this problem until and unless we could try and have a down situation. And therefore, the government on 25th of March finally decided that we need to go for this particular arrangement to have a lockdown situation, so that we can all try to work out in a situation of this kind of a pandemic. Yeah. So there was a total ban arranged or organized, and we were all expected to stay at homes. The government appealed to all of us to not panic, but to support, of course. But unfortunately, what happened is, as the psychology of human beings are, as soon as it was declared that it's a pandemic, and as soon as it was declared that we are going to lock you down in the house, people had an adverse effect, and then